Blood cancers refer to malignancies that arise from a cell that is formed in the bone marrow. That would include white blood cells, platelets, red blood cells. There are some that are more malignant than others. Some of them are indolent and monitored for a really long time. The blood cancers that generally people think of, leukemia, lymphoma, most leukemias arise from white blood cells. There are rare leukemia blood cancers that come from platelets or red blood cells. Lymphoma, lymph nodes are a type of blood organ. There's white blood cells that grow within the lymph nodes, and if those cells go awry, that's usually how lymphoma forms, although lymphoma can also form outside of lymph nodes. Both leukemia and lymphoma are very unique in that they can present in very unusual circumstances sometimes. The four main types of leukemia are AML, which stands for acute myelogenous leukemia, ALL, acute lymphoblastic leukemia, CML, chronic myelogenous leukemia, and CLL, chronic lymphocytic leukemia. So acute myelogenous leukemia, AML, is a difficult disease. It requires intense chemotherapy, sometimes bone marrow transplantation. There are new drugs that are coming out on AML that help us in terms of targeting the abnormal stem cell, the cell that drives the disease, but it's a very tough disease for most people diagnosed with AML. Acute lymphoblastic leukemia is not as common, also very difficult to treat. Also, like AML, is treated with multi-agent systemic chemotherapy. However, there are some new drugs and new treatment modalities called CAR-T, which stands for chimeric antigen receptor T cell therapy. The way this works is cells are taken out from the body and primed to attack lymph cells, usually white blood cells, and there should be more and more treatment options both for AML and ALL, but the first disease that's taking off with CAR-T therapy is ALL. Chronic myelogenous leukemia is a disease that we've done really, really well with. Gleevec, which a lot of people have heard of, has been out for probably over 20 years now. The ability for us to create drugs that bind and specifically interact with the driving force of a disease was a novel idea when Gleevec came out. So it really changed the paradigm of cancer care and other types of diseases, non-oncologic as well. There are some novel drugs that have come out since Gleevec's invention. They're all much more potent inhibitors of the protein that drives CML. For some patients with CML, the level of the protein can be reduced to undetectable, which does bring up the idea of potentially even stopping treatment. So there's been some recent literature on stopping therapy for people who have done really, really well and had complete molecular responses. The disease-related death rates for CML are exceedingly low nowadays because of the effectiveness of treatment. And then CLL, which is chronic lymphocytic leukemia, is the most common type of leukemia in adults. Oftentimes very indolent, doesn't require treatment. Treatment has improved over the last few years as well. There's a newer drug called ibrutinib. Generally, up until the advent of this drug, was essentially resistant to chemotherapy. So nowadays, response rates are immensely good. With leukemia and lymphoma, some of them don't even need treatment. Some of them are indolent and can be monitored with blood counts and symptoms. Those who develop symptoms or have low blood counts or other problems and require treatment, oftentimes the treatment is very effective at controlling the disease depending on the specific problems on each case-to-case sort of scenario. The good news is that there's a lot of drugs in the pipeline. At Florida Cancer Specialists, we have a lot of trials that we work with. I'm very confident and happy that we are proceeding with more and more trials with Sarah Cannon to develop more of these drugs and to give our patients the options and treatment choices that they deserve.